Okay, the cognitive disorders are not to the secret, no ways. They exist and are the most complex. To the three, there have been different designs and disorders that can affect people. We can speak from the Alzheimer in the cardiovascular designs, and the Alzheimer is more common in the of the dementia disorder. Is more affecting to the older adults, and in Colombia it's more increments this year. Is the most important that people with not education live have the prevalence to this problematic and activate to the different alarms of the health institutions since this generate a drastic change in the life state still. For these older adults in the serve from these designs and dementia disorder are also has how true from cognitive, and that the reason which is necessary to know which lifestyle are affect and how they can be correct to improve the health result habits or of these people.
Alzheimer's disease is the most common form of dementia. First of all, we're going to define dementia. Dementia is a brain disorder that severely affects how a person carries out their daily life activities. Alzheimer's has a really slow start. It first starts affecting the parts of the brain that control thought, memory, and language. As we mentioned before, it's important to maintain a nutritional balance, especially in these patients, according to the relationship between individual nutritional needs and ingestion, absorption, and the use of nutrients used in foods. Our project, we're currently using Prosalud guidelines as a multidimensional promotion strategy that includes, and I quote, apply citizenship skills, feed well, perform physical activity, achieve rest suitable, take care of the environment, and strengthen relationships in painting our population and generating benefits in their health and wellness.
The objective of this project is to describe the healthy lifestyle habits that are related to health promotion practices of older adults with dementia and their caregivers in the Sabana Centro region of Colombia for the year 2023. Our PICO strategy is people with dementia and their caregivers. Describe health-related habits. The C is not applicable. For the last, the O is description of health practices. For our theoretical framework, started to mention that mental disorders in recent years have generated a notorious increase in the older adult population, and also that caring for a person living with dementia can be more demanding compared to caring for an older adult without dementia.
Considering the age-related change and the dementia disease, this affects healthy lifestyles and health promotion practice. Since in the most cases, patients and caregivers do not know how to adapt them to the disease. Health promotion can prevent or reduce many consequences of the dementia, such as injuries, falls, mobility difficulties, nutritional problems, problems performing activities of daily living, among others. Despite this, there are few activities aimed at educating and supporting this often vulnerable population. Since the health promotion course provide information on the importance of staying healthy and active while suffering for a chronic condition, health-related behavior, and overall functioning improve of the intervention group. Topics covered during the intervention include healthy lifestyles, cognitive activities, physical activity, recreation, and leisure, nutrition, among others. This is why physical exercise has a beneficial effect on cognition in people with dementia. Thanks to increments in the hippocampus, thus improving memory, we have to also consider the fact that a balanced diet including good fats, different vitamins, consumption of fish, fruits, vegetables, moderate caffeine has a protective effect on the human body, leaving in the evidence that glucose, protein, and healthy fats allow to provide an energetic contribution in the body, in the muscles, and also in provision essential amino acid for the functioning in the nutrition of the cells, vitamins and minerals. Stimulate the metabolic process of the body, and if the body is in good condition, will provide a good cognitive stimulation to the brain.
Finally, for our methodology, we plan to design a cross-sectional study considering the fact that we are going to interview more or less 100 people in a determined period of time for evaluating the specific habits of people with dementia and their caregivers located in Chia, Cundinamarca.